My name is Anita Allen, and my web of causation is on depression in adolescents.
Sleep with candles burning, I leave the door unlocked.
Definitions of depression and adolescent depression have no significant difference. Adolescent depression can be defined as an illness when the feelings of depression persist and interfere with a child or adolescent's ability to function. Children under stress, who experience loss, or who have attentional, learning, or anxiety disorders are at a higher risk for depression. Depression also tends to run in families. However, there are numerous causes responsible for the illness. These include causes like social, genetic, environmental, psychological, and biochemical factors. The main difference between adult and adolescent depression is behavior, which may differ in children and teenagers versus depressed adults. Some signs an adolescent may be depressed include sadness, withdrawal from friends and family, change in weight, difficulty sleeping or oversleeping, feelings of worthlessness, and thoughts of death or suicide. There are 5 different subtypes of depression, and to diagnose any of them, a psychological evaluation is necessary. This evaluation is usually done by a physician or other clinical professional and includes a complete history of symptoms, including when symptoms started, how long they've lasted, their severity, whether or not they've occurred before, family history, and whether the person is thinking about suicide. After the diagnosis, treatment can start. Common treatments for depression include antidepressant medications and psychotherapy. Electroconvulsive therapy, also known as ECT, is another but less conventional method of treatment. This graph shows data from a 2009 to 2012 Health and Nutrition Administration survey provided by the Center for Disease Control. Major depressive disorder is one of the most common mental disorders in the United States. As shown on screen, compared to the general population, adolescent depression is less prevalent than adult depression from ages 18 to 59. Compared to adults ages 60 and older, the rates of adolescent depression are a bit higher. Additionally, women are 70% more likely than men to experience depression during their lifetime. A couple more statistics that are not shown on the graph but are provided by the National Institute of Mental Health are that non-Hispanic blacks are 40% less likely than non-Hispanic whites to experience depression during their lifetime. And the average age of onset is 32 years old. This next graph that is showing is provided by the National Center for Health Statistics and represents the percentage of people over 12 who take antidepressants. I thought this data was important to show because it gives us an idea of how many people are being treated for depression versus the amount of people who actually have depression shown on the previous graph. Although the scales on each graph is a little different, making it a little harder to compare, it shows that roughly only a little over half of the depressed adolescent population is being treated. However, this doesn't include data from methods of treatment other than antidepressants, and neither does it include misdiagnosis. According to Powell, it has been reported that children exposed to higher levels of family conflict, less parental monitoring, and negative parenting styles are more likely to experience depression during adolescence than children who receive consistent positive parenting in families with fewer conflicts. Based on this, family strengths and parent-adolescent communication are 2 determinants I've chosen. A causal model by Grage also supports these determinants as well as self-esteem as a factor for depression. Grage observed a study showing that people with low self-esteem often have feelings of sadness, fatigue, and depression. Research done by Stan Kotblu strived to examine the relationship between socioeconomic status and depression, anxiety, and self-esteem in early adolescence. Although the results showed no relationship between socioeconomic status, anxiety, and self-esteem, it did show that lower socioeconomic status is associated with higher rates of depression. Lastly, numerous research and data has shown that gender is a determinant of depression. More specifically, according to angst, occurrence percentages of major depressive disorder across cultures were nearly twice as high in females as in males, despite fluctuating total prevalence rates. And here is my web of causation showing the 5 determinants that I chose for depression in adolescence. From a social work perspective, I thought it was very important to look at the fact that approximately 70% of adolescents with major depression are not receiving sufficient assessment and treatment, and this is due in part to an imperfect representation of the disorder. A study done by Farmer describes the experience of major depression from the adolescent's perspective to provide a comprehensive understanding of the disorder. His studies showed that adolescents focused on anger, fatigue, and interpersonal difficulties as characteristics of depression. Based on these results, an increased awareness is definitely called for. We need to be more aware of the signs of depression in adolescents of the disorder. A study done by Farmer describes the experience of major depression from the adolescent's perspective. Based on his study, adolescents focused on anger, fatigue, and interpersonal difficulties as characteristics of depression.
My intention is to
These
share
results support the need for an increased awareness of the specific features of adolescent depression, as well as an examination of services accessible for the adolescent population.
And inspire young women through Camp Confidence.
And here is a short clip on the community-based response that I chose.
One of the most beautiful places in the world, a place where we can appreciate our connection to nature as well as each other. A place to discover tools and habits that keep us safe. A place where we find ways to be proud of who we are and where we've come from. Learning how to align with our intuition through experiencing the mind-body connection. We explore the tools to optimize our body and feel comfortable in our own skin. At Camp Confidence, we figure out how to choose the identity we want, not the one we feel pressured to be. We work on the skills needed to be strong, balanced, confident women.
Free falling faster than stars from the sky, falling for love, falling like flies. You build me up, give a reason to why. Can't get enough, no, you take me high.
Although I admire the components and targets of this program, which is making girls comfortable in their own skin and helping them build their confidence, it has not been tested for its effectiveness. My favorite aspect about Camp Confidence is that the target population is the female adolescent. Although it is important that male adolescents get help as well, I like that it's targeting females, which are the more vulnerable population of the two. A couple important things I wanted to go over in concluding my project is that there is no one and quick fix for depression. It comes and goes, and it's something that some people have to deal with for a lifetime. Next, I did want to discuss the fact that depression is a serious disorder that impacts the brain development of adolescents. 1 in 5 individuals experience a serious episode in adolescence, and adolescent girls have twice as many depression episodes compared to boys. Suicide is the 3rd leading cause of death in adolescents and young adults, so it's extremely important to recognize the symptoms in order to prevent worst-case scenarios like suicide. Lastly, I did want to go over some of the impacts of depression, which include both short and long-term consequences. If you take a look at the chart, you can see that interpersonal, academic, risky behaviors, comorbidity, and obesity can lead to long-term consequences. Not that these necessarily go with every case of depression, but it is important to look at. Alright, I hope that you guys all enjoyed my presentation and that you learned a couple of new things. And good luck to you all in your future careers as social workers.